Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back to the Private Practice Survival Guide podcast. In this episode, we're talking about measuring financial performance mid-year and forecasting for your future. So one of the things we want to do is we want to look at where we've been, how we plan to move forward, and where we're going. And so in this episode, we're going to talk all about the different aspects of our look-back period and how we take that into context with forecasting. But let's start with some definitions and let's bring some characteristics to that. So the first definition I want to talk about is this forecasting. Forecasting, it's the process of predicting future outcomes based on historical data, trends, and statistical models. So what that means is we're looking at, hey, this is what I did last year. This is the historical data. And based on this historical data, this is where we are forecasting to be. And so imagine this. Imagine you're on a road trip and you're traveling and you just passed Arkansas and you've driven for 500 miles. Well, you're going to have a look back period to say over the last 500 miles, this is everything that occurred. Over the next 500 miles, what can we forecast? Now, we're going to take into account all the different conditions, the changes, things that are going to impact your forecast, but it will help you better prepare for your future because you have that historical data to work from. And so some of the characteristics when we're looking at forecasting, we need to rely on quantitative data. So we're looking at a time series, we're looking at machine learning analysis, different things that are going to allow us to analytically bring together a comprehensive forecast. It often includes assumptions about external factors, market growth, patterns, etc., and it provides a range of possible outcomes with probabilities. So we have a 60% chance of the following. We have 10% revenue growth if ABC occurs. And so it's giving us a roadmap. It's our GPS for where we hope and plan to be based on historical data and context. And so an example may be that we're going to predict next quarter's production based on past trends. So over the last 3 quarters, we've been able to average 78% productivity in this clinic. And so based on that, and if we add 3 more therapists, when we look at a 78% productivity standard, this is our forecasted of appointments delivered. It's used a lot in performance analysis. So it helps us anticipate future performance to guide on planning, resource allocation, etc. And so as we look at projections, the other thing we discuss is forecasting. We're also looking at projections. And a lot of the time we get mixed up, but the reality is we use both. And so with projections, we're estimating future performance based on assumptions now. So instead of forecasting where we're looking back at historical data, now we're actually looking at the assumptions, the scenarios. And so a scenario may be, hey, if I open ABC Clinic 20 miles from here, I'm going to project that in year 1, we're going to be around this threshold. And the reason why we're projecting that threshold might still take into account this is what the market need is. This is the availability of therapists. This is what we've been through when we've opened up different locations. But we have no historical data with this new location, but we're able to make some projections based on assumptions. And so the characteristics when we look at projections, it's typically tied to hypothetical conditions. So if we move to this location, if we add this many therapists, if we obtain this new insurance contract, these are all hypothetical conditions that allow us to project the potential opportunity. And so it is less reliant on statistical data it's a little bit more bumpy roads. And so I'll say it this way, back to that road trip analogy. If you're in the middle of a road trip, it's easier for you to forecast how your car, your mileage, all of those different things. But let's say that a year from now, you decide instead of driving cross country, you're going to drive south of the border. Well, you're not going to be able to use the same forecasting because you're going different directions. There's going to be different criteria that's going to affect it. You're in a new road, but you may make some projections based on things that you've learned and studied. And so, although you don't have the same statistical data, you're able to anticipate hypothetically what is to occur. And so, from a private practice standpoint, an example would be estimating revenue for a new location based on demographic data and competitor analysis. So, I'm going to open an urgent care system in Oklahoma City. I know that based on the market, it might be a new market for us, but based on the average urgent care bringing in about $1.8 million on a 1,500 square foot location, we're able to project what we anticipate the opportunity to be. And maybe we divide it up where we say it's going to take 3 years to make that projection. The first year it's going to be, maybe it's 15 to 20%. Next year, we're going to get to 50, 60%. And year 3 will make up 100% of that projection. But projections are taking in data, but it's not historic data. And so a lot of the times we're using this in analysis as a what if scenario. If I were to add speech therapy to my occupational and physical therapy practice, what would or could it do to the bottom line? How could it enhance our revenue? And so when we're looking at finance, I'm utilizing both forecasting and projections to anticipate strategically where we want to go with our organization. The other definition that I think is really critical for you to know is look back analysis. So with a look back analysis, we're talking about retrospective evaluation of past performance. We want to know what happened, why, how it happened, etc. And so I use look back analysis all the time. So when I take on a new medical billing client, the first thing we want to do is do a look back analysis. What has occurred over the previous 12 months? Maybe we're doing a look back analysis on prior audits. Maybe we're doing a look back analysis financially and tying it to the way that coding modifiers and payment are being processed. That look back analysis is giving us an evaluation of the history, the retrospective data that has occurred. And often that's where opportunities rest. So today, actually, this morning, I did a look back analysis with a client. And what we found was that there was such a delay in payment based on the way their previous billing company was doing it that they weren't able to optimize all the different codes, modifiers, and payer rules. They did not have payer rules set up correctly, and they were running 90 days delayed in secondary payments. And so that look back period allowed us to strategically prepare on how we're going to overcome and fix that problem. So some of the characteristics when we're looking at this look back analysis, we want to focus on historical data. We want to identify what was a success, what was a failure, and what the root cause was of that success or failure. And so often we use this to validate our forecasting models. And so I talked about historic data. Look back analysis is kind of that process when we're looking at forecasting. So you may do a look back period. So have you ever hired a marketing company? The first thing they're going to do is they're going to do a look back analysis. They're going to say, let me get into your Google Analytics. Let me do a look back on what worked, what didn't work, how much money, what your ad spend was, how you ranked in keywords. And what we're going to do is we're going to actually do a look back analysis on your data historically, but then we're going to also do a data on your competitors. We're going to do a data on the industry, and we're going to be able to see and compare whether you are in alignment with your competitors, with your industry, and what that performance is from a data-driven analytics standpoint. And so that look-back analysis can be utilized in so many ways that you measure your practice. We can do a look-back analysis on clinical outcomes. We can do a look back analysis on KPIs. We can do a look back analysis on your finances, on your marketing effectiveness, on your ROI. All those different things are helping us drive our future strategy based on proven examples of data that historically occurred. And so these allow us to learn lessons. What worked, what didn't work. Even think about it this way. Imagine from a hiring standpoint, what if you did a look back period of every way that you found employees and you saw a trend that the average employee that you have hired via Indeed only lasts 18 months, but the average employee that is referred by someone in your organization is a 5-year average retention. Well, now you may actually prioritize your investment in referral-based recruitment because you see the retention in that look back period is so much less in one avenue versus the other. So how do they interconnect? A look back analysis provides historical context and lessons. It's a grounding force for forecasting and projections. Forecasting uses data from look back analysis to predict the trends with statistical confidence. Projections build on forecasting by incorporating strategic assumptions for scenario projections and planning. So together they create this cycle. Past performance informs prediction forecasting, which guides strategic estimates for projections and later evaluated as a look back again. These are all things that we're going to utilize when we're looking at our mid-year numbers. So I'm a big believer in we analyze in different periods of time. So we have certain KPIs, obviously, that we look at. Some of you look at daily, weekly, monthly. Sometimes we look at a monthly of a daily average. Then we have a quarterly, then we have a biannual, then we have an annual. So all of these methodologies are really important. So the longer that I look at a larger time span, the more it is a hot air balloon view of what's going on. So I'm going to say it to you in this way. If every day you looked at how many appointments canceled, you're so zoomed in that sometimes you miss the trend and you overreact. But if you were to look at that same analysis as every month, we look at what the daily average was. So the total amount for the month divided by how many working days. Now we can compare through look back month over month what we average in daily. So you may have a day where it's really bad, but really why jump at that? Look at the average. And so that's part of our analysis. And so when I'm looking at 2 quarters down, it's really crucial for us to really be able to measure what is the trend in those 2 quarters, that half a year, from the past 6 months. So prior to those 2 quarters, what did that trend look like? And then where do we forecast and project our future? So if we just finished Q1, Q2, we're going to compare Q2, Q1 to Q4 and 3 of the prior year. We also may compare Q1, Q2 over the prior year's Q1, Q2. We're going to look at all of those trends. We're going to make clear, defined analysis that says this occurred, why? This was the root cause. These are the things where we excelled. These are the things where we're not. Are we trending up? Are we trending down? And based on those trends, has anything changed that's going to influence the next 2 quarters? And what about the next 2 quarters do we need to be aware of that occurred from our prior Q3, Q4? So these are all ways that we're evaluating mid-year so that we can predict, project, and plan, even from a staffing standpoint. So one of the things that I always say is that by the time Thanksgiving hits, in many of the practices I work with, our year is over. And so I mean it in the nicest way. It's not that we don't continue to generate revenue, but there is a lull in hiring. There's a lull in patients. Sometimes there's an increase from the standpoint of people exhausting benefits. But at the end of the day, there is a certain theme that occurs. And so once we hit Thanksgiving, in my reality, the year is pretty much over. What's been said, done, and strategized is in place. And now we're preparing for the January. And so at mid-year, I'm actually preparing for a third quarter, early fourth quarter crush it. Because for me, August, September, October, through November until Thanksgiving is where the money is made. That is a huge part of our analysis, is what is to come and how much money. Deductibles have been met. Let's roll with it. So these are all things you want to be looking at. And part of this is the art of performance analysis, which involves systematically evaluating data to understand past and current performance so that you're able to identify trends, informing future decisions so that you have a baseline. It blends quantitative techniques, metrics, statistics, with qualitative judgment, context, intuition to derive actionable insights. So I break down a lot of key components. I like to define forecasting projections, look back, and it's really important that we look at in performance analysis, what is the data collection process? What is the quality? You need to gather relevant data. You need to understand what are those tipping point outliers, taking sometimes the outliers out of the analysis so that it doesn't break down the context in the wrong way. We want to look at our financial metrics, our operational KPIs, our user engagement stats. We want to ensure that data integrity is on the up and up because we don't want that skewed insight. Really, really important. So once we have that data collection and we know its quality, the next thing we want to do is we want to define our metrics and goals. We actually want to break down like, okay, so what are we trying to accomplish? So based on all of this historical data, I am planning to increase our revenue by ABC. This is how we're going to do it. These are the goals that we are setting forth. These are the metrics that are going to measure the progress we are making on behalf of that goal subset. For the past 20 years, I've had the privilege of helping pediatric occupational, physical, and speech therapists redefine the way that their business functions and helping them tap into their entrepreneurial spirit. In recent years, I recognized a deficit, which was bringing private practice owners together with the vision of allowing them to connect, learn, and grow. And Growth Code Conference was born. From sunrise to sunset, we offer an opportunity for pediatric, occupational, physical, speech therapy private practice leaders and owners to connect, collaborate, learn, grow from yoga to breakfast to lunch to coffee carts and more. We take you to another world where you are inspired, where you feel empowered, and where you are able to grow to the next level so that we all can change the world one child at a time. So from an analytical technique standpoint, we're going to do a couple different ways of analysis. So one is we want to do a descriptive analysis. We want to summarize what happened. Hey, in the first 2 quarters, we dropped 20% in revenue as a result of losing 3 employees. We had an issue with TRICARE. We had blah, 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 blah. That's our descriptive analysis. Then we're going to do a diagnostic analysis. That is an identification of what happened. We're diagnosing the problem. So description is summary. Diagnosis is obviously diagnosing the problem. Predictive analysis is predicting what we estimate to happen. And then our prescriptive analysis is where our recommended actions are. So description, hey, we lost $10,000 month over month in Q1 through Q2. The diagnostic analysis is the reason for the loss of revenue is that TRICARE stopped paying claims based on a change of the way their internal systems were working. Predictive analysis is we predict to make up that full 10,000 over the next 2 quarters because now TRICARE is paying. And we are recommending that we increase production to elevate and overcome that loss in our upcoming 2 quarters. So now we've used all these different analytical techniques. The next thing we want to do is utilize statistical tools. So we want to look at a regression. Is there a regression? Is there a time series analysis? And there's different softwares I use. So I use a lot of Excel. There's a lot of people that use Tableau, Python, all different things. Sometimes we're going to utilize systems within our practice management. There's also AI-driven platforms that do this. The other thing is there are companies out there that can help build your BI and your data analysis for you, and they can actually set this all up. So definitely plenty of resources out there. You want to apply visualization to these numbers because it's amazing what happens when you visualize that what's going on. And it's so interesting because I want to say 6 years ago, I missed something in my company. Because of the way that payment and cash flow have a delay, sometimes we're late to the race if we're not seeing the statistics. And I missed that our delivery was going on a 3 to 4 month trend down because our revenue was up. So our revenue was up, our production was down. I missed it, plain and simple. And why it matters is because I missed that we were about to go on a 4 to 6 month revenue drop. And by the time I caught it, it had already, the trend was already there. So we were not prepared for a 6 month drop in revenue that I could have been prepared. Now we overcame it, but if I had been mapping all of those things and having it visually represented in my dashboards, I could have actually been preventative in that approach. And so part of this is understanding what's driving revenue and creating those categories of production and predictive analytics for you. And so the other thing we want to look at is contextual interpretation. We want to combine our data insights with industry trends, market conditions, internal factors. So I've said this a couple of times. In some industries, telehealth is changing. It's a shifting model. It's going more in this arena and less in that arena. These are things we need to keep an eye on. One of the things happening right now while I record this is there's questions about Medicaid based on the current administration and what they're doing in terms of trying to implement some new guidelines with Medicaid, who qualifies. And the first thing I'm seeing is providers are freaking out. Oh my gosh, what is this going to mean? How are we going to lose patients? I'm like, well, we don't know what the timetable is. We don't know, if the patient census we work with will be impacted by this. Like, we sometimes freak out versus doing the research and what are the benefits and how do we optimize, and understanding that even Medicaid, it's a business. And I know that sounds weird, but it is a business. So looking at all of these things and being able to contextually interpret it, is really crucial. And so as we're looking at this, it is an iterative process. We have to continuously refine analysis based on data, feedback, changing goals. We have to balance our short term with our long term. We have to see what do we need in the here and now, but where are we going? Sometimes we're so focused in the here and now that we forget to plan. And so I actually had another meeting earlier today. And one of the things I loved was the private practice owner said, hey, I'm not right now where I need to be. I get that. But I see where we're going. And I actually see that we are climbing this hill and we're going to be at the target that you're talking about, Brandon, sooner than we can even imagine. Well, that's important. So the here and now, they're not there, but they're coming. They see that future. They know how they're getting there. They know the contracts and the staff and the different ways they're going to get there. And so that's really important in our performance analysis, is that refining and understanding and changing goals and updating. Communication plays a big part of this. We need to present our findings to stakeholders. So when we're doing our mid-year analysis, we need to be able to communicate. We're here. This is where we intended to be. We're not there. This is why. This is where we plan to be. And at the end of the day, we're going to make up the loss from the first half in the second half. And this is the way that we're going to do it. Utilizing executive summaries, using storytelling, showcasing data, both historic, from the history standpoint, but also saying, hey, based on our predictive analytics, we are able to forecast the following. We are able to project that we will be ABC and why, where, how. So one of the things that we do during our mid-year is we analyze, we do a cross comparison approach. And one of the things I want to look at is the profitability analysis. I want to measure your profitability because sometimes what I see is that quarters have trends. So the first quarter sometimes can be the lowest profitability. The fourth quarter could be the highest profitability, depending on your practice. That can have to do with deductibles. That can have to do with insurance. That can have to do with benefit resets and when you're paying. Like even something like this, your profitability could be down the first quarter because you pay all of your work comp liability, all of that in the first quarter of every year for the year. So maybe from a cash flow basis, your profitability is really down, but on an accrual basis, your profitability is up. These are all things we want to do. So we want to assess your ability to generate profit related to revenue, expenses, and assets. We're going to look at your gross profit margin, the revenue minus cost of services. We're going to measure the profitability after direct costs. We're going to measure your net profit margin, net income, showing your overall profitability, what's left over, as I call it, the meat on the bone statistic. We're going to look at each service and where the highest margins are. So one of the things that a lot of practices fight me on, and you don't have to agree with me here, but they fight me on this mindset of, well, I got to treat every patient the same. I'm like, I totally get it. I am not telling you to change the way that you treat patients. But what I need you to do is I need you to identify how your business functions algorithmically, and you have to make choices that are optimally for what you're trying to do. And as I like to say, no margin, no mission. So sometimes what we're able to do, we understand we're in the supply and demand business. Our demand in most cases is greater than the supply. So we need to ensure when we look at our supply that we are optimizing that resource. And so just like any resource goes up and down, we need to optimize the value of that resource. And so it's really important that you know, like a dental practice finds that orthodontics generates a 40% margin while cleanings only yield 15%. We need to ensure what is the role of orthodontics in our practice. It doesn't mean we can't do cleanings. Cleanings can be a means to that, but we need to identify both our high margin, our low margin, and what that percentage is. You know, recently I had a client and they said to me, Brandon, we're losing money on our Medicaid population. I said, okay. And they said, we're like 70% Medicaid and we're losing money on all of those appointments. And this is not consulting. Disclaimer, you got to check with your lawyers and everything. So please don't hold me to this. But what I said is one of the things you need to do is you need to discuss with your contract to say, we are not able to exceed a 40% ratio of our population through Medicaid population. Otherwise, we'll have to close our doors. Set that really plain and simple in your contract so they understand that you only have a capacity to serve that public of 40% as an example, and that your vision, mission, and purpose is to serve your entire community, not just the Medicaid community, and that when you reach that 40% capacity, you're not able to accept additional Medicaid until you free up spots. Now, again, go through your contract, make sure that's clean with them. But one of the things we also looked at is we said, hey, maybe we have more Medicaid availability in the morning, we have less in the afternoon, and we just make all of that transparent, and contractually we ensure that we get approval. But that way we are able to treat everyone, but we're also recognizing we got to be in the business. And if we stop focusing on the business, we're not going to be in business anymore. So by us being able to set these parameters, we're able to better serve our Medicaid population that does do it. And the reality is someone's like, well, what about all the kids that don't get the services they need and all that? And I go, that is a fight that every family and every provider needs to fight on a legislative level. See, the problem that I find is a lot of practitioners are trying to fight that battle as a accessibility model, and they don't recognize they're not going to win that battle unless they fight it legislatively. If Medicaid was able to pay more, you would be able to create more accessibility. If I'm losing $10 on every Medicaid client, I can't solve that problem because I'm going to go out of business. So it becomes a nonprofit action. And so figuring out solutions on a legislative way will help you run that. In addition to that profitability, we want to look at our revenue analysis. We want to look at what are the sources, the trends, the reliability of income. So back to that Medicaid. Hey, Medicaid builds a really good sustainability. Maybe you say, I want 60% of our business to be Medicaid. I worry about any time you have one payer source that represents a majority share because it puts you at risk. I used to have a clinic that was, I think, 60% Blue Cross. And we ran into an issue where we were like, this no longer is serving us. And we could not make up their fill fast enough to sustain losing that contract. So continuing to diversify revenue by payer is really important. Looking at your RCM management, revenue cycle management, tracking billing efficiency on your half-year mark, tracking your patient visits, your collections, your denial rates, what your AR is, what that patient volume trend is, really crucial. Looking at seasonal versus growth patterns, really, really important. As we look at this, then we want to break down our cost and expense analysis. At that half-year mark, we want to measure where are we at in comparison to our budget. What are our fixed versus variable expenses? What did we predict? What are we forecasting? And how do we shape our overhead analysis and our cost per patient per visit? So these are all things that are really crucial. I also look at cash flow. How did we fare in cash flow Q1 and Q2 over the previous 4 quarters before us? What was that cash flow? What are the trends? What's our AR look like? What's our break-even analysis? Knowing your break-even is really critical and being able to communicate that break-even. So we have a break-even of 130 appointments a day. If we are not doing 130 appointments a day, we are losing money. That's really important. That's a very valuable milestone. And I use this break even as a really critical part because even when we talk about HR and compensation, all that, I need employees to understand what is the minimum viability, which is our break even, what is our target, and what is our bonusable. So what is our break even? What is our target? And where are we overachieving? And overachieving is not something we can plan on every day, but when we do it, we're going to celebrate it. So this is going to help us on that break-even analysis inform our pricing, our staffing, our expansion decisions, all of those different things. We want to look at our budget variance. As I said, we want to see where is our budget now in actuality compared to where we projected it to be. How close? Where is it? That kind of cross comparison. We're going to look at our KPI analysis. Where did our KPIs come in? Patient acquisition, our marketing spend, our appointment no-show rate, our missed appointments, all those different things, our provider productivity. These are all things we're going to measure at this halfway point in the year to make sure that we can forecast and we can project accordingly. We're going to do our look back analysis on our first half of the year versus everything else. We're going to be able to forecast for the future. And so through that cross comparison approach, we're going to do several different things. We're going to look at internal comparison. What did we do internally versus, where we're at now prior? We're going to look at our industry benchmarking. So we're going to take everything we just did and we're going to compare it to industry benchmarks. We may even do a peer-to-peer group comparison. So I have these groups with practice owners and all the time they'll do peer-to-peer. Hey, what are you doing here? And what are you doing there, et cetera. And then we may also do our competitor analysis. How are we performing in comparison to the competitors? And so looking at all of that is really important. When you're looking at a cross comparison, you want to select your metrics, you want to gather your data, you want to normalize the data so you adjust for differences such as practice size, patient demographics, and analyze those gaps and then act on the insights that you have. And so these are all things that are going to be very helpful. Some tools and resources that I like to utilize. There's different softwares, whether you're using your practice management, your EMR, your QuickBooks, your Cario, your KPI dashboarding. Sometimes we're utilizing software like Accounted For. Sometimes companies like Econologics and different groups like that can help as well. I use MGMA as well. MGMA, Medical Group Management Association, has great data. NSCHBC is great for dental. There's all different ways for us to cross-reference data, and you just got to go to those tools so that you're getting them. And once you have that data, Change management is when financial forecasts are doom and gloom. You need to be able to communicate it transparently. You need to have an action plan. You need to be like, hey, we're falling behind. This is how we're going to overcome it. Prioritize quick wins. Develop your clear action plan. Support your staff, and ultimately leverage external expertise, sometimes bringing in outside practitioners, outside consultants, and ultimately, you cannot lose focus on the patient, because when you lose focus on the patient, you're going to lose focus on your team. So even though we're making these change management components, we need to be willing and able to embrace that component. So did you know a 2025 medical economics report project that practices conducting mid-year financial reviews are 28% more likely to meet revenue goals, with 65% improving their forecasting accuracy? This stuff matters. So in the words of Maya Angelou, if you don't know where you've come from, you don't know where you're going. Thank you for tuning into this episode of the Private Practice Survival Guide podcast. Don't forget, together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.